Okay, so hi, Assalamualaikum, and very good morning to all. So my name is Wanurauda. Okay.
My name is Jay Danya.
Hi, my name is Halini.
Hi, my name is Falina Fina.
My name is Nabil Afla.
My name is Yuling.
Okay.
So we are from the course Academic and Professional Language, and then this is the discussion for the topics that we're going to select, and also a brief discussion on how are we going to collect the information
To create the report.
for our report writing.
So there are several suggested topics. So the first, wait, let me. Do any of you have the suggested topics?
Well, I can't share screen, honestly. I tried and it failed.
Okay. There are 10 different suggested topics, and then we do filter some that we think that is quite relevant and more interesting to discuss, which is the first one is healthcare facilities often face staff shortages, and the second would be, if I'm not mistaken, cybersecurity threats, and the last one is something about AI or the challenges regarding the use of artificial intelligence, and in which we all agree that the topic is quite boring and overused. So now we only have two topics that I
Rada,
think we should discuss. Yes.
there's actually like a lot more. You link share this one. There's like a lot more.
Mm-hmm.
So we can like go through one by one lah. But I think like the healthcare staff shortages one is a interesting one also. So but we can go through each one of these topics also and look first lah.
Okay. So for the first problem, in which it says that many cities are overcrowded. I personally think that this topic itself is not that interesting enough because yes, there are cities that are overcrowded, but it's not a problem yet for me to think that we should um to create a solution for this problem.
And also it's like less related to our course, computer science. So I guess we'll skip this one.
I agree, and I feel like the second one also it's talking about encouraging women in engineering, but I feel like it's a topic that is often talked about also, so we can kind of skip that and move to the next.
Yeah. That one, next one is also many developing countries lack access to reliable energy. I think it's a boring topic and not it's a boring topic. It's more on, I think it's harder to find research documents to
I
discuss.
agree. The
Guys, background is loud, so I'm going to change my position.
Okay. I think the fourth topic, which is the healthcare facilities, often face staff shortages. We have a lot of resource for this one, and since most of us are in bioinformatics, and also other computer science courses, actually do relate to our courses. So I think this can be quite easy for us um to find solution for this one. What do you guys think?
Yeah, I think
Yes,
it's a topic that's less talked about compared to other topics.
Yeah. Do you guys okay with my background sound?
Yeah.
Okay, so I think the number 4 is quite interesting for me. because I think there's a lot of solutions, and I think it's very interesting for us to discuss about this because I think a lot of people didn't know a lot about this topic. They don't talk about this too much. So I think it's quite interesting topic for our report. What do you guys think?
I agree. I think this would be a perfect topic.
I agree also.
Or do you guys want to see another topic before we choose this topic?
I think I'm good.
We can go briefly to other options. So next we have traffic congestion, which I think it's a problem that is discussed too oftenly. And then we're not interested in it either, and it's not quite related to computer science. So next is about social media, and then I guess
Yeah, social media is again another very common topic and all. And even the seventh one, which is like environmental topic, that one also is a very common topic. So I think we can skip all that. And cybersecurity was something that we had in mind earlier. But for me, if you were to compare the healthcare one and the cybersecurity one, I feel like the healthcare one is more interesting. So what do you all think?
and also we don't have background in cybersecurity because I don't think any of us are from the course of network and security, right?
But to be honest,
Hmm?
like the topic number 7 is quite interesting for me. But if you guys choose number 4, then we choose based on the majority. I'm okay with that.
Okay.
Sorry guys, my battery died, so I was away for a minute.
Mm.
Can you guys just briefly explain what happened in between? Sorry, I'm so sorry.
So basically, just now we discussed which topic is the best to put in our report writing, and most of us, majority of us, agree on the fourth topic, which is
Yes, I think. Yeah, I agree too. As I
so all
said
of us
earlier,
agree
I
on
think
that.
it's a topic.
Mhm.
Nabil,
As I
Afla,
said
are you
earlier,
okay with the
I'm
topic and all?
yeah, okay. I think it is very interesting for us to discuss the topic because the majority of us is from bioinformatics, right?
So although it's quite, I wouldn't say quite famous, but it has been talked about this topic in particular, which is staff shortages in healthcare field. When exactly does the problem start?
uh, okay, can you hear me?
Yes, I can hear.
I personally would say this became a very big problem or more known problem during COVID,
Agree.
where all the healthcare staffs barely had time to rest and then barely had any. I think that's when the topic became a very common issue or like known issue. It was an issue before then also, but just that we never really talked about it. But now that, there are a lot of graduates, medical graduates that are not getting jobs, and then those who are already in healthcare doesn't have enough rest and all. I think this problem has been going on for quite time, like since COVID was 5 years ago, and we still have this problem going on.
I agree. Even before when COVID was a pandemic, and now we can call it endemic, right? Since COVID is not exactly a huge problem for us, even still that the problem wasn't solved, actually become more prominent now that we can actually see the problem. Um, so I guess the problem started during 2020. So is that when COVID hits? And
Around 2019, 2020 lah.
yeah,
20.
Mm. And yeah, I agree. It's been a big hit since then, and like we can clearly see. In fact, after in this endemic season, we can actually see the diseases are like not to say diseases, but we are having more patients these days. There are much more cases of people getting sick faster. It might be from the injection and all that, but like there's a lot more cases after COVID also, and it's also playing a big impact in the staff shortages.
Yeah, agree. So for the second question, sorry, Yuli, can you show the second question? Yes. Uh, oh, oh, what is the origin of the problem? So I feel
I
like,
think the first question and the second question we actually answer it.
oh yeah,
Yeah, answer it already.
But
It's
what
okay, we'll
caused
skip to the next one.
this problem? I would say, I'm not sure, but I would say it's because of the doctors or nurses not well paid enough because they spend like more than 5 years to get the degree, but I would say they didn't get enough well paid. So they choose to not being a doctor, I would say. But what do you guys think?
I can see your
Yeah, I
point of
think
view.
quite.
Mhm.
Sorry. I carry on. Sorry.
Sorry, you go ahead first.
I was like, okay. Yeah, I think quite a number of them are moving to overseas as well, as you said, because of the underpaid issue. So we are having less doctors and medical staffs under Malaysia in general, I think. Around you can continue.
I can see like,
Can you guys hear me?
yes.
Because it's raining heavily. Okay. So like I agree with what you all said also, and it's also like possibly because in general all this while when you study for doctorate and you apply for jobs, somehow it's always been like um too many people are going for doctorate and like they're not getting the job, they're not getting a proper position and all that. So even since last time, for some reason, doctors were not getting hired properly. And now even with the patients increasing at all, they are still not getting a proper job placement at all. So I feel like instead and with that people are also giving up in taking doctorate, and also it's becoming a thing where since our whole era is now moving into a very technological era and depending on AI and all that, I think it's more logical also like if we look into creating like AI related or robotics related ways to help in this issue.
I actually agree on your point. When we can actually see that the technology will actually do improve quite a lot, but when it comes to medical field, yes, we have found quite a new technology and all that and new innovation, but it's not very well used or not quite commonly used, in which I think is one of the point that we should discuss later on.
So since you guys have covered about the shortage of um human not human resource, but yeah, human resource, and then also on the other side we do face shortage of in terms of equipment and the distribution of it, and especially in parts for example in suburban area or rural area. It's quite a common question that in any of their clinics or hospitals, if they do have one, they face problems in terms of they don't get enough of equipment supply, and then uh, it might due to transportation, but it also might due to the lack in general, the lack of equipment manufacturing.
I also agree with you, Lin, which we can see from the pandemic hits last time. Many equipments like masks or test kits is face shortage, and it is really important for us to implement the robots in healthcare.
Can we actually go back to the point before, which is before the manufacturing problem is the surgery problem, is that I do think that a huge reason on why we are lacking in staff is that um, when it comes to surgery, it's quite a huge responsibilities. People do not really want to take on that responsibility, especially when it comes to human lives. So when we innovate a new technology in which we can accurately do the surgery with less, what do you call that? Less risk, is when people will start to be more interested in this particular work. So by improving the technology, basically create a robotic surgery or even create things like VR and AR in surgery, in which can improve student skills in general, can actually basically overcome the potential student who do not want to study in this area because they are too scared to try and be passionate about this field. Any of you want to start?
Yeah, so I do agree with you guys. And is it okay if we move to the next question? So, it says here, so why is this a problem and this problem affect the company? So, to be honest, about this problem, I would say is for me is such a big problem because I can see that there's a lot of situations that you can see that people mostly go to the emergency room, but a lot of cases that there's a lot of patient died in the emergency room because of the short case of the doctors and also the room, especially when the COVID-19. So what do you guys think? Do you guys agree with me or you guys have different opinion?
I agree. It's very true that and it's bound to happen because nowadays like the staffs are being overworked and the patients are getting less attention. So when you have a lot of patients, especially like during COVID-19 time, like sudden surge of the amount of patients and all that, mistakes are very likely to happen, and this will all result into affecting in a very dangerous way towards the patients itself. So our community is in danger because of this. So I agree to Fadli.
Yeah, I think apart from mistakes, even when you ask for an appointment, right? Let's say, uh, maybe my local hospital or clinic doesn't have a certain facility, so they refer me to another hospital, a bigger hospital which has all the resources. So not only the hospital in my area, but similar uh, hospitals with similar issues, they will refer it to that one specific hospital in that area, right? So there will be a long queue of patients waiting for their appointments, and they won't be treated immediately because there are some exceptional cases where the emergency people also like taking over the queue. So you might have detected your problem in the earlier stage, but because of waiting in the queue waiting for the appointment for a long time, problem just goes just problem just gets worse and worse. So I think it
And
definitely affects the quality of life.
and when we speak about how people generally think about the healthcare system, when it comes to the perception in specifically in Malaysia, almost all of us would say that it would take a long queue if we was to ask for a specific operations or uh, health or a healthcare service. And most often, if people they do have the financial ability, they will seek for private medical field. And then, but for those who cannot afford those things, their first perception when it comes to the fact that they have a health problem is the fact that they don't want to face it, or they will try, but when it's said that they will take a long queue but they don't have the money to go for the private options, then they will just let uh their health conditions to further worsen. And and it kind of create a bad perceptions among the community that our local healthcare is just they just don't have a good support. So I guess it's if we want to say among the community, then I would say among the citizens, we all agree with that. Either or not, we have been encountered that situations.
Yeah, also if we can see that for the government hospitals like or small hospitals, they won't likely to give attention to the patients with minor injuries like that. So the patients would likely to get ignored, and they will be moved to the big hospitals, as the doctors and nurses are very shortage of staff. So they won't give the attention to those patients.
I agree. So moving on to the next question, which is what is the possible solutions to this problem? We have discussed about this before previously, and I think we need to rediscuss because I'm still not sure. Basically.
But I guess it's if we base on the topic that we choose, it should the solutions to this problem should be that we use robotics to enhance patient care, in which we can further discuss what are the details about the robotics and how they can help to improve our current healthcare system.
I personally think that we need to go back to basic, which is that technology, or like we have said before, is that it can actually improve our education system. Is that when it comes to university students, they also need a lot of resources in which will cost a lot of money, like basically I guess buy corpses to practice on. Instead of just doing that, we can try to move this type of practice to AR or VR solution, in which can actually improve better, because they can actually see the 3D of the VR AR, and can actually yeah. Any of you wants to argue?
I agree with you, and I also believe that when we use robotics, when we come up with robotics, it can also help with nurses in patient care, like by handling deliveries inside the hospital, like bringing equipments to doctors for their surgeries or whatever. And then like they can also monitor patients' vitals easily instead of having always like a nurse there to monitor each patient. And they can also if we have the facilities to like build robots that can help lift and move patients around, that is also another way how it will be very helpful for the staffs lah. And yeah, from as of now, that's one idea that I thought of.
Yeah.
Yeah,
When you
so
said
I do
that,
agree.
okay,
Oh,
sorry.
sorry. I'm so sorry. So I do agree with Jaidanya. Since I read an article somewhere, it's actually there's a research, or in Japan, if I'm not mistaken, they actually create like a robot for patients, where the patients basically specifically for the disease for dementia. So this is basically for the elderly. So the robot is like shaped like a baby seal, so it's very cute. It may not replace the human being, but it actually help a little bit for them to actually enjoy themselves, and they don't know, they actually help smooth the patients where macam sorry who are otherwise difficult to reach. So I think robot like this, they call it paro. Robot like this actually do help a lot when it comes to like short case of doctors. So I think robot like this toys, I would say toys because it looks so cute, and it's not really do something, but it just be there for the patients, for especially for the dementia patients. So what do you guys think? You guys have another opinion or ideas?
I do agree,
Yeah, I
actually.
do.
Wait, can I say something before this meeting ends? By the way, we almost reached 40 minutes for this, so we might need to restart the recording. Is that when you say people can use robots for improving daily life of patient, is that I think about radiographer as well. If you think about radiologists who basically works in a place where they are exposed to radio, blah blah blah, X-rays and all that, is that when we use robots instead, we can actually um, make that the radiologists do not have to face such X-rays, so they don't get sick from that. So since we all have discussed exactly what we're going to write it down, is there any suggestion that you guys would like to add?
I think since we already know how we have discussed so much on the topic just now, right? As in solution, like you said, surgery and all. So I think we can already start to discuss how we want to draft our essay or report. So like we all said just now, one is also one of the main point will be for surgery. Use robotics in healthcare under surgery aspect.
Mm-hmm.
As in we can take over risky surgeries who might need expertise. Since we might lack expertise, robotics can take over that. Okay, we can explain that in detail in report. What were the other ideas, anyone?
In terms of the manufacturing of equipment, if we use robotics, then I guess we can not skip, but like we can use like actual human in the manufacturing, and also a better hygiene, since robotics they don't cause any problems in terms of hygienes, and then also faster and then more productions of equipment. Any other aspect?
I believe that when it comes to robots in general, I feel like we already talked about robots. For surgery, in this case, we can also talk about telesurgery. Telesurgery is basically we communicate with other doctors outside of the country or even outside of the hospitals, so we can improve the quality of the surgery with the professionals and not going to the said hospital. Okay.
So basically, I'm sorry. Like since we kind of like running out of time, I would say I can see that you guys concluding that for our report we need like a surgery, and then like Yuling said we need like a topic related to manufacturing. So do you guys have another ideas for another subtopic? What about
I think actually initially
uh-huh.
sorry to interrupt. Okay, this one actually Dania was explaining about the patient care, like how we could use robotics that carry around patients or take over admin work. So I think that would be another aspect, since our problem focuses on staff shortage and also limited resources. So we'll focus on patient care as well. We'll focus on uh, overcoming staff shortage. So we have three aspects. One is surgery, another one is manufacturing, and third one will be patient care in terms of staff shortage. Is there anything you all would like to add or anything that I missed out?
I think everything is okay, but how do you guys want to separate it, the work or the topics?
Since we have three topics, so I guess we just split into three. one for 2 group members since we have 6 of us.
But Yuling, isn't it like, yeah, there will be 3 reports from each group, but then if we are going to really separate each topic to one group for this one, I don't think we can actually like talk that much about it. We can give examples a lot, yes, but to give points in our report for like okay lah, for example, we take surgery. So how many points can you come up under surgery that is not example to write a report, you know? So I think
All right, okay.
in my opinion, it's better that we do the same report, but our 3 main topics would be these 3 ideas. It's just how we explain our
deliver
perspectives.
and
Yeah.
yeah, I guess even though we have the same aspect, but we can come up with different suggestion or methods of solutions. So I guess it's better that we all of us we cover everything, but that our approaches are different.
Okay. I think that's all. Anyone wants to add anything? Okay. Thank you, guys.
Thank you, guys.
Thank you.
Thank you.
I will end this meeting.